What are we looking at? Biceps. Remember the way that the biceps tendon falls into that bicipital groove? There's a ligament that holds that down. Sometimes that ligament is damaged. So you're going to have them hold their arm in this position and say, don't let me pull down. And you should, you can also palpate that bicipital groove there and forcibly try to bring the arm down. There should be no pain. You should feel no movement or clicking under your finger. Or if you do, that's a sign that there's instability of that tendon. Yergesons, same thing. You're trying to evaluate the integrity of the biceps tendon as it lies in that bicipital groove. So remember, against your resistance, you're going to have them supinate, actively supinate against your resistance. You can also use a hand to palpate that bicipital groove as well. And as they try to do that resisted motion, again, no pain, no clicking. You should feel no movement in that area. If so, that's a positive sign. Bicipital tendonitis or instability of that biceps tendon. Yergesons. Yep. Shoulder apprehension test. What are we looking at there? Yep, good. Again, with the apprehension test, you're going to stand behind them, bring their arm up, and with this hand, you're going to push this way. You're either looking for them to want to hit you, or they're going to say something like, that hurts, or what do you do? And that's a positive sign. Just like with the patella, because there's a propensity, because there's weakness there, of that shoulder to dislocate. They don't feel comfortable with that position.
So you're doing that both ways? Like push the shoulder forward and...
Yeah, with this hand, you're pulling towards you.
Yeah.
This hand, you're pushing forward.
But you don't do it pushing back and then...
What do you mean pushing back?
Push the shoulder.
Just this way. But you're not doing it that way. Apley scratch, remember that's just a general range of motion. You're checking adduction, internal rotation, adduction, external rotation. The painful arc. Painful arc. What are we looking for with the painful arc? Where it gets stuck, what's usually causing it? Remember, it's an impingement, and it could be an impingement. Remember the anatomy of that supraspinatus. It goes underneath that collarbone to then go to the greater tubercle of the humerus. So sometimes overuse causes a thickening of that muscle or the tendon itself. Sometimes that subacromial bursa gets inflamed and starts pushing that tendon against the clavicle. So it's going to cause an impingement syndrome. Usually with the painful arc at about 60 degrees to 120 degrees, that's when that patient's going to get that pain, and that's a positive finding. And that's an indication of an impingement. Again, and then that's where, remember that Hawkins test is where you have them bring the arm in the front, hold this position, don't let me push down. That's going to further cause impingement of that shoulder. So that's a positive Hawkins test. If holding the arm this way, don't let me push it down, and it's causing a pinching. Dugas test, I think we went over briefly. That's where if this is the affected side, you're going to have them bring it to the opposite shoulder and then drop it. If there's pain or there's discomfort with that, it's usually a sign of a shoulder dislocation, chronic shoulder dislocation again. Dugas. This is the affected side. Yeah. They're going to come over. They're going to rest that hand on the opposite shoulder and then bring that arm down. They should be able to do that with ease. There should be no apprehension, no pain, no instability when they do that. In front of them, and you're pushing down. Yeah. Don't let me push down. And they should be able to, resist you. It's an impingement. It's an impingement issue. That's what I was going to get to now. I just...
Okay, I've got these.
So Allen's. What are we looking at with Allen's test? Yeah. Allen's test is, remember the neurovascular bundle, we're assessing the integrity of the arteries that are going to the hands. So like in a thoracic outlet syndrome, if there's a compression of that neurovascular bundle, we want to see if it's a vascular issue or a nerve issue. So that's where Allen's is going to help to evaluate the vasculature. Remember, you're going to have them open and close this hand about 30 seconds, maybe a minute, drain all that blood out, and then make a fist. After they make that fist, you're then going to cover the radial and the ulnar artery, bring that hand down, then have them open up that hand. Then take your finger off the radial side. You're going to see the capillary fill. How quickly does that fill up? It should be pretty instant. And then you're going to go to the ulnar side. How quickly does that fill up? And again, that should be pretty instant as well. That's going to help to evaluate the integrity of the vasculature to the hand. Wright's test. Yep, like the Wright brothers, like an airplane. So you're going to get a radial pulse. You're then going to, once you get a good radial pulse, you're going to then bring that arm off to the side. So bring it up, and a little bit back too. And you're going to see if there's any obliteration of that radial pulse. Again, that's usually a positive sign for like a thoracic outlet syndrome, usually because pec minor is compressing that neurovascular bundle. And I would do both sides, affected and unaffected side. Any questions on upper extremity right now? They can be used for TOS, yes. Not necessarily. That's more for instability of the elbow, kind of like with the knee, just a general instability of the collateral ligaments. Oh, no, I didn't. It's not on. So clunk test. Patient's going to be supine. Think of it, it's almost like a supine apprehension test. So you're going to bring the arm back and down and a little bit of overpressure on the humerus. Normally there should be no pain, there should be no clunk, but if there's a labral tear, there's going to be a palpable clunk or an audible, clunk in that area, and the patient's going to have pain with that, and that's a sign of a labral tear in the shoulder. Thank you for reminding, because it's not on mine. Yeah, you're going to